I'm excited to speak to everyone because it's a unique program, unlike other workshops or education programs or seminars where we gain more knowledge, whereas we attain wisdom through this UHV program. And also, learning values is primary and learning knowledge is secondary. In any medical workshop, we learn skills, knowledge, all these things, but values, there is very rare places we learn. So it is one such place. So these kind of gatherings for exploring values, self-exploration, self-realization, and realizing one's full potential is very much unique to India. But because of the influence of Westerners, it has disappeared. Now is the time to reclaim the pride of our country. So with this preload, let me share my journey in UHV and holistic human health. I think it will be useful to my co-explorers. So, and before going to share our experience in holistic human health in our institution, I'll share my journey first. I was seeking truth and meaning of life for many, many years through many, many resources like spiritual books, methods like contemplation, meditation, etc. Then I came across UHV-I, impressed upon the title, and I tried to experiment with UHV. So I attended UHV-I via online in December 2022. I was astonished by the content and the process, the commitment of the facilitators and volunteers. I was glued to my PC for 5 days continuously, attending continuous quizzes, polls. I was much impressed about the universal human values. So which led me to participate in face-to-face UHV-II course in the month of May, June 2023. The facilitator was none other than Umesh Bhaiya, and the exploratory journey hand in hand with him for the 5 days were amazing. It's a great transformation happened through these 5 days. Then I began to attend morning sessions led by Sharmila Asthanaji. It made me to explore myself in a deeper way. Finally, I came to 8 days face-to-face FDP workshop, UHV-III FDP led by Ganesh ji in the first week of May 2024, which brought total transformation to myself and the body. So let me share what changes happened to me. The way I see people and the world suddenly changed. In the past, I was much anxious and worried. I had a sort of fear when interacting with others. In UHV only, I had the proposal that the other is similar to me and we complement each other. So that sentence has struck me, and I explored myself this proposal and verified by right understanding. I experimented it in day-to-day interactions with others and I gained trust with others. So I could feel a sense of happiness, peace, calmness, which changed the way I interact with others. Now I respond to other people. In fact, there is no other, but still I respond when I interact with the other rather than reacting. And affection, care, love became my natural response than reacting with anger and hatredness. So really UHV is an eye-opener to me. To understand the real problems at all levels are due to lack of right understanding. I understood that in the current society, people are living in conflict with each other. Terrorism, wars are existing, pollution is happening, resource depletion is happening because of the fact that people are not living with right understanding, right feelings, and only with the sole purpose of accumulation of physical facility by any means. The proposals placed are easy to verify on the basis of right understanding in reference to natural acceptance. Then I could be able to understand the importance to bring about change in the field of education, which might help to create change at family level, society level, at the level of nature and existence. So universal human values are the guiding light in my journey toward becoming not just knowledgeable professional, but compassionate and empathetic individual. It reminds me the importance of the 9 feelings which is there, that is trust, respect, affection, care, guidance, reverence, glory, and gratitude and love in all my interactions, be it in the classroom or the workplace or within our communities. So coming to holistic human health, I attended 5 days holistic human health face-to-face FDP in February 2024 under the guidance of Sharmila Asthanaji. It was a tremendous experience, which Rajulji was also there at the time, and it has made me to understand health in a holistic perspective, not a fragmented approach by current medical science. So I understood that better health includes both physical and mental health. That is, it includes self and the body, not only the body. To understand health in totality, I need to understand the human being, relationships, society, nature, and existence. So all are interconnected. That is, coexistence is existence. So it has changed my vision of health. It made me to realize true well-being cannot be achieved through the mere absence of illness. Rather, it requires a harmonious balance between all the levels, that is self and body, as well as in the family, society, nature, and existence. So by recognizing and embracing this holistic approach, I'm empowered myself to lead healthier, more fulfilling lives, to inspire others to do the same. To conclude, I have realized that UH is the essential missing link in our current education system. By introducing it, it will guide our institutions towards self-transformation, thereby societal transformation. This transformation might happen much quicker if we focus on educating UHV in all the educational institutions as urgently as possible. If I change, my family will change. If my family changes, my society will change. And ultimately, the world has to change. But the process begins in oneself first. This become a deeper principle now. So together, let us embark on this enriching transformative journey toward a brighter, healthier future for ourselves and for generations to come. So I think that is my journey in UHV and holistic human health. Now coming back to experience with holistic human health at our institution. So I think I've been given the introduction. So let me skip this slide. And so before, let me first highlight the vision for holistic value-based education institution. So why we implemented this, then only we can understand the other aspects. So we started a holistic value-based education because we thought that it will help the students to explore their basic aspiration, that is happiness and prosperity. Thereby, they will trust each other and relate to others with right feelings. So with this vision, it might lead to mutual happiness and mutual prosperity, and they will discover a sense of responsibility towards the larger orders, family, society, and nation, so that the transformation can happen at the larger levels by having the sense of responsibility at the individual level. So that is the vision for HVB in our institution. So based on this, we introduced UHV-I, II, as well as the holistic human health. We are going to introduce it. So in short, holistic human health as well as holistic value-based education, all these measures can be a great game changer, which can transform our entire society by igniting young minds the clear vision of seeing life with an entirely different perspective, which is holistic. So generally, we follow the fragmented approach, but this UHV only gives the holistic vision. So now going to holistic human health, you can see the title there, the textbook, I mean the book, which is one of the greatest books which I ever read. So the book you see, that is Holistic Human Health. It is authored by Sathyanarayanan, Shuklaji as well as Perumalji. And it deals with understanding the human being and self, as well as universal health principles and specific recommendations for health practices and process for ensuring the health in the self, the body, health, and health of environment. It is freely available in the AICT website, but you can read through that. It's a very valuable book. You'll come to know why I'm saying this, because currently the health system which follow modern scientific medicine, we call it as, or Western medicine, there are certain limitations for that. So first limitation is fragmented view of health. The modern medicine thinks we are just the body. There is no self anywhere. So that's a basic misconcept. So that leads to isolated approach, organ or disease-centric approach, which has led to more and more complications. Second limitation is over-medicalization. Third limit is rise in psychosomatic disease. You can see, body and mind are related. We read now body-mind connections, but in Western medicine, nobody is thinking about that. So there are peptic ulcers, psoriasis, chronic back pain, fatigue syndrome. Some of these are coming. And also another limitation is chronic disease burden. You can see rise in hypertension, diabetes everywhere, but the approach is towards treatment, not the preventive aspects. And the treatment is also required for lifelong. So these are all limitations of modern medicine. Then accessibility and affordability issues, mental health gaps, rising depression, all these problems are the limitations. Why it happens? Because we feel it is a fragmented approach. They think body is the reality. There is no self there. But in UHV, self is the primary reality. So based on this, we can approach holistic approach to human health. So human being is the coexistence of self and body, and health of the self is the first priority. If you start living like that, then you can prevent illnesses. You can see the holistic program for health. Two aspects are there. One is for staying healthy. Second is for bringing body back to harmony from temporary disharmony. Third aspect is dependence on the drug machine to perform a body function. So modern medicine focuses upon only these things: treatment, that is medicine and treatment. But the holistic human health approaches like this. So intake and routine is the first part. Labor and exercise is the second part. Third part is postures for regulating internal and external and regulated breathing. So all these things will be helpful in preventing the disease rather than treating the disease. So this prevention comes first rather than treating the diseases. And holistic approach to human health also involves all aspects, all the four levels. So we think health of the body is primary. That is what Western medicine says. But here, UHV holistic approach is health is self comes first by understanding the human being, understanding the self. Harmony comes in the self, leading to harmony in the body also. So understanding the body will lead to harmony in the body. Understanding the environment lead to harmony in the family, society, as well as existence. So all these three levels, self, body, environment is happy, then of course the health will be for everyone. So it is well-being for all. That is a goal that happens only when we approach the health through holistic approach. So by keeping all these things in mind, we have started implementing our vision for MBBS students. So in our college, usually they come from school, they enter the first year where we have foundation course that is being taken now. So currently we have introduced UHV-I is part of the foundation course for first MBBS students. Now the new students are coming, they are much impressed by our, the way of the new things, which proposals we place, and a very good question they are asking. So it was very interesting to teach UHV-II first year students. And in future, we also will be introducing the Indian knowledge system also. So that's the first thing. Then second year, we have introduced UHV-II also. This year, we will introduce that. And now they are, initially there are a little bit hesitation is there, but in the course progresses, they really become much impressed. It made a great impact on their self and the body. So that is the second year. Third year, we'll be implementing soon holistic human health, its philosophy and practice. And fourth year, they'll be learning foundation course in Indian constitutional values. So all these bridges for the bridge 1, bridge 2, bridge 3, bridge 4 will make them as a holistic personality rather than fragmented person. So alongside, they have outreach activities and community health activities. So this is our plan for our vision to implement in our medical college. So we have done so far, we took up the proposal to the institutional leadership team. You can see in the picture, Umesh ji with our Honorable Pro-Vice Chancellor and Dean. And in this picture, you can see Raju Rasthana ji and Sharmila ji with Supraja ji and me and Dr. Mirnalini. And in this picture, of course, we all there in the picture. So that's the thing we done first. Then second thing is we built a core team of self-motivated proactive doctors. Initially, we started with 5 people, only 5 people who completed UHV-II. Then we developed our team into a bigger team. And then we conducted faculty development program on holistic human health. So this is a very impressive program where doctors majority participated in this, and they had different views. And it was a great 5 days where Samraji was leading the program. So we also introduced to MBBS students, which I already told, foundation courses and value-added courses encourage value-based discussions. So these are lecture class where students were very much enthusiastic in participating in universal human values. And we also initiated students buddy club, where students who are interested, they can form a friendly, students can form a buddy club, where they will help the next year students when they come in first year, they let them settle there in the college. Also, they'll guide them towards values as well as other difficulties where they are facing. So that is students buddy club. So after UHV-I in first year, these are the feedback received by us, by the students, by the voices from the first year students. Just imagine they're from school and the first year itself, they're learning values, first thing they learn here in our college. They told this feedback. That is, Vidya Palraj has told this. I have decided to bring happiness from within. Abhya Sharma has told this, to look at your past in a different person's perspective and realizing that the point there to better understand myself and change for the better. And like that, the several feedback we have received, only for highlighting few things only I have put. So they were very much impressed. And the next we have done is conducted sensitization programs or courses on holistic human health across the university. So we gave talks to the interested faculties. Then the faculties who attended the holistic human health workshop, they given an impactful review. So Professor Sathyanarayanan, the Department of Anesthesiology, has given this review. It became evident that human health extends beyond mere physical well-being, encompassing the harmony of the self. Integral to our learning was the recognition of the relationship between personal health and the health of the environment, be it our family, society, or nature. My perspectives on nutrition, hydration, and breathing underwent profound shifts. So these sort of holistic human health workshops are rare to get because it comprises of holistic perspective. So I advise you, please arrange such workshops in your institutions also, so that we can have a broad view on the health rather than a limited view. So like that, we received several the reviews which are very positive because these were Western trained doctors, Western medicine trained doctors. They given a lot of good reviews. So finally, moving forward, faculty targeted measures, we plan to organize FDPs on holistic human health, both introductory and human health too. So as well as for targeting students, we introduce already we introduced value-added courses, but we would like to introduce value-added courses on holistic human health, introducing elective courses for MBBS, AHS students, and 3 credit semester course on holistic human health, and inculcating health activities through Students Buddy Club. All these are future plans. And public health related measures, we are starting holistic centers of well-being, health education and practice on how to stay healthy for all patients and doctors and staff. This is an integrative approach. We practice Western medicine, still we can reduce there our approach on holistic vision. Then counseling services for faculties and students and public, student outreach activities for environmental cleanliness and health. So that is our experience with holistic human health in our institution. So see, I've come to the end of my lecture, and our life doesn't get better by chance; it gets better by change. So let us begin the change within us, then we can change others, because we have the most powerful weapon in our hands, which is education, which we can use to change the world. So first transformation happens to individual level, then there will be societal transformation, not vice versa. So we have seen this for past century, and thank you very much for patient listening. Thank you so much.